Brisbane's peak sports performance lasting endurance protocols. These are some protocols that I want to share with you. That's more about neurology than about muscles. We'll deal with muscles in part 2. This is part 1. However, I'd like to ask you a question. Be you a professional sports player or an amateur sports player, have you had experiences of niggling, reoccurring sports injuries? You've gone out, had an injury, had it repaired by some therapist. You may have been out of your game for a week, 2 weeks, 3 weeks, and in some cases up to 6 months, only to have this injury come back again. Well, I'm here to tell you that the muscle is only the result. The injured muscle is the result. Unless you actually had a physical contact, as in contact sports, that's a different story. However, if you're a runner or you're a hockey player, you're a tennis racket player, any of these sports where you're just using your physical and there's no contact, but you pull a muscle or a muscle gets over tight or overstrained, I'm here to tell you that it is your nervous system. And the nervous system is one area where there has been very, very little attention. In fact, no attention. Some people may go to a neurologist, but he just follows the nerve system itself. And we're not really into that. What we're into is something called the neuroreflexes. And these neuroreflexes can become compromised. And when the neuroreflexes are compromised, then every aspect of your body is also compromised. Did you know that? Were you aware of that? And there is a potential. There's a potential for injury. You see, your body operates on reactive muscles. You've got top to bottom, front to back muscle system, so that you can move through time and space. And you only have to have one of those muscles go into spasm and it throws the whole system out. What drives that whole muscle system is the gait reflexes. And the gait reflexes are top to bottom, front to back. And these gait reflexes are behind your ear, on your eyebrows, in your groin, on your pubic bone, and on your bum bone. And they have to operate top to bottom in crossovers and front to back. And if these are not fully switched on, then there's always potential for injury. For the majority of peoples, not only sports peoples, but the majority of peoples, they're only partially on. And they're on strong enough for you to go to the gym and lift a few weights and build up muscles and so on. But when you really put them to the test, because the current, the neurological current, isn't getting a strong signal from the brain right through to the muscle fibre, there's a potential for injury. So I'm here to inform you that this type of work is working directly with your brain, directly with the specific muscle, if it works out that way. However, before we even work on the specific muscle, we go through and reset all the reflexes. And these gait reflexes are used in all sports. Running, jumping, hopping, skipping, rolling, dancing, climbing, hockey, swinging, rugby, rugby league, rugby union, AFL, you name it, it has to involve these reflexes. And all sports involve the fight-flight mechanism. So the fight-flight mechanism has to be also checked out, because the fight-flight mechanism on the majority of people is overactive. And this is part of why people get adrenal excitement, adrenal fatigue, sore calf muscles. It's all tied in neurologically. So what these protocols do through applied bioneurology is reset these protocols so that you can perform better, reduce the chance of injury. That's the priority, is to reduce the chance of injury. However, when you get a very strong signal, you will have lasting endurance. It's very important to keep your body hydrated when you can, where you can, because the water helps a better neurosignaling process. Now, everything that I am saying is testable. There is nothing that I am saying at this point in time that I have not got a test for. But this test is very different to the usual types of outside tests. You know, people might put instruments on your body and wire up your head and so on. However, I talk directly with your brain. And your brain has a way of giving biofeedback. And through this mechanism, it's very quick, it's very simple. It tells me what is under stress. Then I can do a correction to a specific muscle and then see if the brain's got the message. And once the brain's got the message, the tension out of that muscle eases off. Now, what happens a lot of times is a muscle will go into spasm and it is actually reacting to other muscles. And they are the ones that do cause challenges. However, through this protocol, there's a very, very simple way of identifying the reactive muscle and releasing that tension to all the other muscles within its group. And we will go into muscles on the part 2 of this series and explain a little bit as to why these muscles cramp up. However, any form of stress is a good starting point. Any form of over-stimulation, over-exercise will cause your muscle fibres to bunch up. When there has been an injury, the brain remembers that injury, and sometimes it will send a signal to the bellies of the muscles where the spindle cells and the proprioceptor cells are, and tell that muscle not to extend itself to its maximum range because it got injured. It has that memory. However, in sport, you do need and require to get to that maximum range of extension. So what we do is reset the neurology first. And once we reset the neurology first, a whole range of things just come together. You may be a person who's got lower backache, and in say the lumbar 3 area, and it can be a backache just by simply stooping over and picking up a match. However, that is related to the fight-flight mechanism. And that, again, is a complete reactive system on a muscular level and through the neurology. You may be a person who has sore hips, hip pain, joint pain, or sciatica pain. And a lot of people are working down in this area of your body, on your hips, all the muscles around there. When actually the problem is neurological to two reflexes to the side of your head. And when they are reset, if you're a person who has a left short leg, just working on these reflexes here, it comes back together itself. Whereas if you're working on the hips, it might be good for a day, but it'll most certainly come out again. Now you might say, well, how do I know? How can I tell whether my gait reflexes are not working? And that's very easy. You just put your hands down the side. Well, go and stand in front of a mirror first, of course. Drop your hands down along the side. Close your eyes for 3 or 4 seconds. Open your eyes. And then if you notice one shoulder higher than the other, that's an indication your gait reflexes are compromised. They're not working optimum. And you already have a reactive muscle system that is compromised. And that reflex that causes that is what we call the labyrinthine reflex behind the ear. And it puts a whole range of muscles out of sync. And this is where some people will get a lot of tightness, either under their collarbone, not under their collarbone, under their shoulder blade, or all down one side of their spine, maybe on the lower part of the other spine. One of the worst things that can happen is if you've experienced a concussion. Now, you see concussion happening all the time on the football field, and this has been a big concern of mine for the last 28 years. And nothing has been done properly. In fact, it's only in the last 2 or 3, 4 years that they've started to do something. At least they've recognised it. And then they put them through these concussion tests. Well, they're only external tests. They're not neurological tests. And when you have a concussion, right side, left side, both sides, it completely disrupts your whole neurological reflex system. And this is why a lot of people who have had a concussion, they will report after the concussion, it's like I have a brain fog. And there is 9 reflexes all around the head that has to be reset. Even the sutures between the bone structures have to be reset. There's a skin direction that has to be looked for. And the skin direction has to be reset. And there is another little test that we do. It's not for my benefit, it is for your benefit to see that your right and your left hemisphere are not communicating. However, when we do this cranial reflex and a very specialised concussion correction, all of a sudden that brain fog is gone. You've got your brain back again, so to speak. And then we can work on all the other neuroreflexes that have been compromised and get you set up so that you can get lasting endurance and peak performance. So I hope this message has been able to give you a little bit of understanding that it is more important to work on the neurology of your body before the muscles of your body. And it's fine to go to the gym and get exercise and build up your muscles and so on. However, every one of those muscles will fatigue on our particular type of test, because they're all over tight in the first place. And they have to be reset. The spindle cells and the proprioceptor cells and the bellies of the muscles all have to be reset. And once they're reset, you're completely relaxed, you're completely energized, and your strength ability just about doubles. When I say strength ability, you feel stronger. You can hold something up like that much longer than prior to it. If you lifted up a heavy bag on one hand, after a while, it just goes down. And when it goes down, that's telling you your neurology is under stress and the muscles can't support it. But when you have these neuro reflexes reset, you can hold it and hold it and hold it and hold it. It will surprise you. So if this has given you some good information, you can contact me through the mobile phone number or through the website. Thank you.